Welcome, everybody. I'm Dr. Mark Hyman, and I'm thrilled to be here today to have a conversation about one of the most important topics in healthcare today, which is food as medicine. Food has the potential to both cause and cure most chronic diseases, and over 11 million people die every year globally from not eating the right foods and too much of the wrong foods. It's a bigger killer than smoking or anything else. 88% of Americans are metabolically unhealthy, which means they have high cholesterol, blood sugar, or blood pressure, all caused primarily by bad food and not enough good food. And today, we're going to talk about why it's so important for us to think about how we can pay for the right treatments for patients with chronic illness. If food is the biggest cure and the biggest cause, then we have to fix food in order to solve our chronic disease problems and our economic burden from those chronic disease problems. You know, what does food as medicine mean? I think people think, oh yeah, it's food as medicine. It sounds good, but is it actually medicine? It actually is medicine. There are literally compounds in food that can heal disease. The quality of the food really matters. And dozens of studies have showed that actually eating a healthy diet reduces healthcare costs dramatically associated with chronic disease and improves overall health and wellness. And actually shows a 3 to 4x return on every dollar spent, which is important because now we're up to $4.1 trillion per year in healthcare costs, with 20% of our GDP. And chronic disease accounts for about 90% of that. And most of chronic disease is caused by food and can be cured by food.
Because at the end of the day, what I have learned about this, medicine, we call medicine to so many different things, but the real medicine, we are the one who create it. And it's when you put good food in your body. That's going to be the end of the day medicine, because that's what's going to provide durability and quality. You know, once you start eating well, once you start eating healthy, you're not gonna have to, like my dad had to take so many medication for the diabetes so he can create so he can create a balance in his body. But why is that? Because when my dad was younger, I remember how my dad used to eat and how my dad used to go at that thing, and it'll catch up towards the end. Some people, unfortunately, it'll catch up on them earlier than some other, but at the end of the day, it's the same result.
Yeah.
So I'm a big fan of what Prakash and Mark I bring to the table, and I think I talked too much. I'm gonna let you guys.
No, your voice is so important, and you know your personal experience with this is your own health and your father's health and your community's health, and trying to find food that tastes good and is good. You know, it's a false dichotomy between, you know, food that is good for you and is going to taste bad versus food that's good for you and going to taste good. So you're right. It has to be yummy, and it can be. And I think, you know, people don't understand how delicious good food can be. And if you know, you're talking about diabetes in your dad, it's such a big problem. It's like 1/3 of Medicare expenditures are for diabetes, which is 100% reversible. In your sense of things, you know, you're working with, you know, Medicare Advantage. Is there an interest? You see these payers like now wanting to do this, thinking about longer term meal delivery. I mean, because Medicare, Medicaid tend to move slowly, but are you seeing the private sector actually drive this more?
Yes. And look, it's a partnership. This is something that we can do on both fronts. And that's, again, back to Congressman's approach here, which I think is going to be very helpful. CMS has been a leader in so many areas, and we in the private sector are following. I think this is an example where we can lead more. And you know, with the ability in 2020 to offer these additional supplemental benefits like meal and other like transportation, other things, you know, above and beyond the dental and vision that we would be able to do for several years. I think these are all the right movements. And you know, I'll just add this, and then I think I know we want to keep to time here with Congressman, but I think the other thing that's helping, Mark, is we're seeing the impact beyond cost. So the meal support goes beyond reducing medical costs, especially with those who have chronic conditions. It's a tremendous member engagement approach in a very personal way. So what does this mean? This means that, for example, it uniquely enables performance kitchen nutritionists and dietitians to address social drivers of health. And, you know, we've talked a lot about this in the past as well, including access to quality food. How do you evaluate food, you know, impact on improving medication adherence? There's that connection as well. And ultimately, you know, how do we make sure that we have better retention, better long-term relationship with our members, improve the experience and really reduce that churn? And that helps the payers as well, because when you have a longitudinal relationship, you're not thinking about that 6-month, 9-month, 12-month. You really are thinking about that whole person over a longer period of time. So I think that's what these medically prescribed meals over a longer period of time have that ability to make that kind of impact.
I mean, it's clearly the right thing to do medically, and it's the right thing to do economically. And I think, I've talked to a lot of congressmen, senators, the White House. I've been around the rounds there. Like, oh, we have to restrict access to services because or Medicare is going to go bankrupt. Or no, we need Medicare for all. I'm like, no, we need to think differently about the medical care we're delivering so we don't have to be restricting medical care. Because if we think about literally diabetes could be eliminated in a year in America. If everybody got the food delivered to them and they ate it, which is, a big behavioral issue, and there's a lot about behavior change, then we literally could cure this problem almost overnight and save billions and billions and billions and billions of dollars. Congressman McGovern, I want to talk about this important bill because there's finally a bill in Congress that was introduced in September 2021 by you and other colleagues called HR 5370, Medically Tailored Home Delivered Meals Demonstration and Pilot Act of 2021. So you're actually just not saying, let's do this. You're saying, let's just study this. So that's a simple on-ramp. So tell us about the bill, why it's so important, what does it do, and what's the status of the bill now, and how we can help move this forward.
Well, first of all, Mark, thank you for having me on this Zoom call. And Prakash, it's great to see you again. And I can't believe I'm on a Zoom call with David Ortiz, but that'll impress my kids. And
we're all mutually starstruck. We're all mutually starstruck. It's okay.
But come on, Jim. You can have me whatever you want.
Okay. Well, look, I think we all have kind of established the fact that for whatever reason there is a disconnect between our health care system and nutrition, and it makes no sense, but it exists, and it's hard to change things, even when we all know that change is good. And so this is a pilot program. One is we want to make sure we get it right, but two, we have to get people to buy into it. We have to make sure that this change happens. And this basically would provide hospitals with the resources to be able to partner with outside organizations, to prepare and deliver, medically tailored meals to people who they think should qualify for it. And look, I've been working with organizations like Community Servings in Boston, God's Love We Deliver in New York City, and Manna in Philadelphia, and seeing some of the great work that they have done, but it's limited because there's a lack of coverage. And they've also taught me that good, nutritious food can smell and taste as good as the food my grandmother used to make. So good, nutritious food doesn't have to taste lousy.
No.
And look, I've also been working very closely with Dari Musafarian, our friend, the dean of the Tufts Nutrition School. I mean, they've done tons of research on this, but we know food is medicine, and we know that if we provide the authority for Medicare to help reimburse this, then we can get this thing going at a bigger scale. We can document the benefits of this program. We can also document the savings. I mean, there are lots of avoidable healthcare costs that we're paying for now because of the lack of connection between health and nutrition.
And I think the call to action for everybody listening is to tweet your local congressman to support this bill and click on the link, which provides you a letter that you can actually email your congressman. That'll be in the notes along with this Zoom. So I think it's so important that we take action. It's not that much work. It doesn't take much, but I think most of you don't think your voice matters, but it does. Your voice matters, your vote matters, and people listen in Washington. Imagine if everybody listening, we had millions of people or hundreds of thousands of people submitting that they want to support this bill. It will get the attention of the people that matter. So really there's a way we can all play a role and be active. And I think this is really a call to action around taking a stand to do the right thing at the right time, because we're getting sicker and sicker and it's costing more and more. And this is a death spiral. And we actually can get out of it by using food as medicine and understanding the power of this incredible therapy that we've neglected in medicine for so long.